One of my specialties is pediatric foot problems, and the most common problem I see in kids is heel pain. Now, there's one primary cause of heel pain in children, or at least the most common cause, and that's a condition called calcaneal apophysitis. It's also called Sever's disease. Now, when we're born, this heel bone here is made of all cartilage, and then it starts to go from cartilage to bone, and it starts growing in two areas in the bone. One, the main area is up here, and the other area is in the back of the heel. In between here, it's cartilage. And at about the age of 9, 10, 11, 12, usually somewhere between 8 and 13, you've got an area that's almost all bone here, with a very thin layer of cartilage in between. That's the growth plate, also called the apophysis of the bone. And that's the weakest portion of the bone. And in kids, particularly active kids, you have two big structures that attach into the bone here and here, and basically start playing tug-of-war with it and can start to irritate the growth plate. So you have the structures are the Achilles tendon attaching in there and the plantar fascia attaching in down there. Apophysitis, itis just means inflammation, and again, apophysis is the growth plate. So all this is an inflammation of the growth plate. Now, left alone, it will get better all by itself, but it can take several years for that to happen, so we will almost always want to treat it. So our two primary goals are to get tension off of this region and to get rid of the inflammation. Now, to get tension off of it, we want to take tension, first of all, off the plantar fascia. And the plantar fascia gets tight when that foot flattens down. So we're usually going to get a specially made, these are actually prefabricated over-the-counter supports that are made for children, and they go underneath the arch and they stop that arch from going down and they take tension off the plantar fascia. And then second is we might use a lift a little bit under the heel to take tension off of the Achilles tendon. Those two things together do a great job at taking stress off the growth plate of the bone and letting that tissue heal. In some cases, we do need to put the child into a walking boot for a couple of weeks and really just let it rest. That type of treatment, along with some icing and some anti-inflammatory medications, and so in some cases, will almost always eliminate the tension and pressure and then get rid of the inflammation in that area. So this is usually a fairly easy problem to treat. If you're in our area and your child is having heel pain, please make an appointment to come in and see us. If you're not in our area, find a podiatrist that does specialize in pediatrics, and particularly pediatric sports medicine. If you want more information on this, just go to our website and do a search for children's heel pain. We have a lot of information there on some home treatment hints. You might want to try those for a couple weeks, and if you're still not better, then go see a podiatrist. If you like these videos, please subscribe to our channel, and thanks for watching.